Film campaign groups are calling on the NHS to do more to help patients who are trying to get medical cannabis. They claim that since legalisation last year, there have been no new NHS prescriptions for medical cannabis containing the two main components of the cannabis plant, CBD and THC. In the meantime, private cannabis clinics are opening in the UK and the private sector is offering patients what they cannot get on the NHS. The costs of that can run to hundreds of pounds a month. Here's Sophia Batista's report.
This is medical cannabis. It's been legal in the UK for almost a year.
I really can't imagine my life without cannabis.
But there's a problem.
Nothing's happened, nothing's changed.
People are not getting it on the NHS. And as a result, private clinics are opening up.
We can be a lifeline for patients in need.
But this comes at a cost.
It's outrageous and cruel that patients are having to spend so much of their own money.
So why did the government legalise medical cannabis if the NHS isn't prescribing it? And are private cannabis clinics the only option for patients? Medical cannabis was made legal in November 2018. Many with conditions like epilepsy, chronic pain and MS got their hopes up.
Today's announcement is so special.
They thought this would open up their treatment options, but that hasn't happened. And in this vacuum, the private sector has seen a gap in the market.
I'm on my way to a private cannabis clinic that's about to open in London. It looks like patients with chronic conditions are resorting to places like this because they say it's impossible to get a prescription on the NHS.
Patients who come to this clinic need to be approved by a specialist doctor before they can get a prescription.
So there are some conditions for which I think there's good evidence for cannabis to be useful. So you'd have to have one of those conditions, like pain, for example, or anxiety, or nausea and sickness in the context of chemotherapy, or epilepsy.
The problem? It's very expensive.
The consultation fee to the patient is a fairly standard amount of £250. Then on top of that, when they receive the prescription from their chemist, they'll have to pay something like £600 to £800 per month for the prescription.
Most people can never afford this. Do you think you're exploiting patients?
No, absolutely not exploiting patients at all. This is the only way patients who are in significant need can get access to this medicine, and that's very sad. It's the only way they can get the medicine they deserve.
But it's people like these who suffer. Charlotte has brain damage and epilepsy. Her mother Cheryl has been trying to get cannabis on the NHS, but was refused twice. She was told it was because she hadn't tried all options available, and it was too expensive for the NHS to prescribe it.
So I think it's absolutely disgusting that anyone is having to pay to go private and get a private prescription. The thought of having to pay that on a regular basis, on a monthly basis to fulfil it.
Would you be able to afford it?
I wouldn't be able to afford to sustain a private prescription on a long-term basis at all, no. I mean, I'm a single mother looking after my daughter. I do work, I don't receive any benefits myself.
And the problem is not lack of supply.
About 3/4 of all medical cannabis that's imported into the UK comes into this facility. They sort it, package it, and deliver it to patients and pharmacists across the country.
It sounds straightforward, but it isn't. The medicine has to go through a lot of rigorous checks, and it takes about 8 weeks to obtain it after it's prescribed. They only import the exact amount they need to fulfill their prescriptions. And that's what makes it so expensive.
And how much would this be?
Something like that is in the region of £500-ish.
£500 for this? And it only lasts for 1 month?
The plant is grown in a controlled environment to ensure it has specific levels of chemicals to treat health conditions.
How many prescription requests have you got since cannabis was made legal last year?
We've received approximately 100 prescriptions so far. All of them have come from the private sector. I think it's fair to say that the NHS hasn't prescribed any cannabis to date.
The two most important chemicals in the cannabis plant are THC and CBD. THC is the part of the cannabis plant that makes people feel high, whereas CBD doesn't have the mind-altering effects that cause that high. But campaign groups say limiting medicine to products that contain only CBD isn't enough. They want access to a wider variety of cannabis-based medicines, some of which contain THC. Like Chelsea, she treats her epilepsy with cannabis. Her vape contains THC and CBD. She says she hasn't had a single seizure since she started using it.
It's completely changed my life. I really can't imagine my life without cannabis. I really feel so grateful that I found this medicine. You know, I've seen cannabis transform people's lives.
The only reason Chelsea can get cannabis is that she lives in New York, and she's brought her medicine with her, while her sister Tamsin, who has a much more severe form of epilepsy, can't get a prescription on the NHS because she lives in the UK.
So what would Tamsin's life have been like if she'd been given cannabis as a baby? Maybe she wouldn't be living in full-time care now. You know, maybe her mental age wouldn't be of a 13-year-old. It shouldn't be about where you're located, you know, and that's what we're seeing with my sister and I, where I live in the US and I have access because of my address and she doesn't because of her address.
So why did the government decide to make medical cannabis legal if the NHS isn't prescribing it?
I don't think the government had done its homework, if I'm perfectly honest. The government raised people's expectations that following legalisation, medicinal cannabis would become readily available. It hasn't. If anything, it's become more difficult for people to obtain it.
Is the UK government failing patients?
I think the UK government is failing patients. The government was wrong to raise expectations. It now has to put that right by delivering on the promises that it's made to the patients.
This cannabis revolution needs to be led by science, and so far it's been led by politics. And I think what people forget is that, you know, for many patients, including my sister, this is a life or death situation.
The Department of Health told us that this pattern of prescribing medical cannabis is quite normal, and that in most countries that have legalized the drug, most prescriptions are given through the private sector. They also said they need more evidence to prove that it works.
Campaigners were recently dealt a further blow after a healthcare watchdog said that a lot of medical cannabis products shouldn't be available on the NHS because they're not cost-effective and more clinical trials are needed.
Sadly, at the present time, the only way a patient can get a prescription for medical cannabis is through this clinic.
For now, people say they will be left suffering, in need of medicine that they can't afford.
Well, last week, NICE published its draft recommendations on the use of cannabis-based medicinal products, which found a lack of evidence about their long-term safety and effectiveness. However, it's now open for public consultation. We can talk now to the man responsible for NICE's guideline programme, Paul Crisp. And also in the studio, we've got Hannah Deacon. Her son Alfie has severe epilepsy, and last year he was issued with the first medical cannabis licence in the UK. Also joining us from Brighton is Clark French. He has MS, and he openly admits he breaks the law to obtain medical cannabis, which he cannot get on the NHS. Welcome, all of you. Hannah, I'll come to you first of all, because the issue is that cannabis was legalised for medical use last year and people still aren't getting NHS prescriptions. Your son Alfie has one of only two NHS prescriptions in the United Kingdom. It's fiendishly complicated, isn't it? But just tell us for you why it is, and for Alfie why it is so important that he gets it, what difference it's made to him.
Well, I mean, to put it into context briefly, he went from 48 hospital admissions in 1 year before we went to Holland to hardly any since we've been home, and it's about quality of life. You know, we're not talking about a cure here. We're talking about giving a little boy the best quality of life. If you look at the Chief Medical Officer's report, which was issued last July, she said in that there is conclusive evidence throughout the world that cannabis-based medicine should be available. Then the ACMD also said doctors should be able to prescribe cannabis-based medicines. Then the Home Secretary said when he changed the law that he was doing it to help people like my child. And then unfortunately when the law has changed, we have seen the brakes go on completely. I work with 20 families with Endar Pain. They are all now seeking private prescriptions costing thousands of pounds a month. They wouldn't be doing that if it wasn't working. And when they are going to their doctors in their hospitals, their doctors are saying to them, I cannot prescribe for you because of the guidelines. I am not allowed to. And these families are being put in dire straits. It's fantastic that the NHS review talks about observational trials, but we can't wait 6 months. You know, these children need help today. You know, there's talk in these nice guidelines about shared care arrangements. Why can't the private neurologist that prescribes for these children share the care with the NHS doctors? We want to see practical, you know, quick, urgent ways of helping these people, and it's not happening. And I think, yes, we need research, yes, we need to understand, but we also need to not put our heads in the sand. Israel have been doing research into cannabis for 25 years. We know about the endocannabinoid system. We know about the entourage effect. Why has that panel not talked to their colleagues across the world? It seems extremely arrogant, and patients will suffer and end up, like Clark is doing, going to the black market. When you have a serious illness, that should not be happening.
Paul, I mentioned, I mean, the systems are really complicated to try to get something funneled through in the end on the NHS, but it does boil down to a simple principle, doesn't it? That those who use it say it works, those who cannot get it on the NHS, and that's everyone except for Alfie and another child, are paying a huge amount of money because they say it works. There is, it seems, evidence, so why is it? What is the block? Why does NICE still say there is not enough evidence?
Okay, well, so the question that we were asked to answer was what's the clinical and cost effectiveness of cannabis-based medicinal products for a range of conditions, one of which was epilepsy. And the committee that we work with, we looked at international evidence, we looked across the world, we do this, we scour the literature for the evidence. And our committee felt that there wasn't enough evidence to really fully assess the safety and effectiveness of cannabis-based medicines for epilepsy. So what
about, sorry to interrupt, but what about Alfie? He was having so many hospital admissions, and now he's not.
Yeah, so again, we recognise that. We recognise that people do benefit, absolutely. So what we aren't saying is it shouldn't be used. That's not what we are saying at all. What we're saying is there needs to be more research. These medicines are unlicensed, which means they haven't gone through the regulatory process to see whether they are safe or effective or to what quality they are produced, nor the dosage, nor when they should be started or stopped. So there's the whole regulatory framework for medicines in this country, which is designed to keep people safe. So the evidence base...
So you're saying you're effectively running into bureaucracy as well, and there's only so much that you can do, is that it?
That's not what I'm saying. What I'm saying is that we were asked to look at the evidence for cannabis-based medicinal products. We expected not to find much because no product is licensed. Indeed, that is what we did find. But we do know, and we experiences like Hannah and Alfie, that people do benefit. And we felt that if we said no, what that would do, it would stop the further research that we desperately need, and it would also prevent other people access to these medicines if it was right for them after they've exhausted every other licensed medicine.
So the door, so the door is then open for the research to be done and for ultimately prescriptions to be available on the NHS. But how long would this process take? Because the law was changed in last November.
Sure. Yeah. So again, I think it's about the NHS is saying, right, we can support more randomised controlled trials. That's the gold standard. That's what you need to get a regulatory approval. But what we've also recognised is observational data. So let's learn from the experiences of people who are already receiving cannabis-based medicines. And what does that tell us about the effectiveness? What does that tell us about their safety? But until we have that, clinicians simply don't have the confidence
I want to obviously bring in Clark and also hear from you, but just absolutely. There's just one last thing though with Paul, which is that Was the government completely wrong to legalise something then that is not licensed for use? Because it raises expectations, and it sounds like there's no way actually that the NHS is going to fund it while it's not licensed.
No, I don't think the government was wrong to do that. I think what, like in any clinical situation, there are unlicensed medicines are available, and the way that doctors prescribe, they work through licensed medicines, and for some people, licensed medicines simply don't work. So that's when people need to talk to specialists and say, look, we've tried everything, nothing works for us, we're aware of this unlicensed medicine, can we have a conversation? We know there may be uncertainties about the evidence, but what's right for them? So it does, that deregulation, that rescheduling did allow that access.
Okay. You want to
I'm afraid, you know, what you're saying is what should happen, but it is not what's happening. What do you suggest that the families that I work with who all have private prescriptions, what do you suggest that they do now? Because they cannot afford £2,000 and £3,000 a month ongoing. They can't do it. They have evidence that their children are better. They are going to their doctors in the NHS and they are saying to them, my child is better, and the doctors are saying, it's fantastic, your child isn't coming into hospital anymore. I can't prescribe for you. The BPNA guidance says I can't. My trust says I can't. My medical director says I can't. So whilst you're saying that conversation should be happening and doctors should have the right to prescribe, it is simply not happening. It is not the truth. And I speak to these parents every day, and I'm sorry to get upset, but they are fundraising thousands of pounds a month to try and keep their children out of hospital, to try and keep their children alive, and the government have failed those people over and over again, and I am absolutely disgusted, to be quite honest, because those parents, they have no services, they have no help, they have no money, and they are being asked, and they are making their children better. My son has been on medical cannabis for nearly 2 years. No one has collected data on him, no one. We're doing a lot of talking, there's no action, and people are being failed. The public are being failed, and we must, as a good society, surely, for God's sake, help these patients quickly.
So, respond to that then, Paul.
Sure. So, Hannah, I do understand your frustration. And
it's not frustration, it's upset. I've experienced what these families are going through, and it's horrendous. And if you did better guidance that helped, that if the NHS England, Matt Hancock stopped talking about what he should do and what you should do, and actually there was some action, it's not frustration, it's beyond frustration. It's fear that my child or these children will die. It's not frustration, and unfortunately, with your panel, I know you had one parent on there, but you did not talk to these patients. You should have talked to the MS Society. You should have talked to me.
Why didn't you?
You didn't talk to the patients that are
that's
the people that need it.
That's why we have a
for 4 weeks
consultation.
during the summer
why not do
holidays
that
when
before the
everyone's
guidance
away.
comes out? Sorry, why not do that before the guidance comes out? It seems like would be sensible to do up front, no?
The way we work, we always have lay members on our committees, and we open up our draft guidelines to consultation. So that's the way we deal with that. Can I go back to your question about what we can do about it? And I think at the outset,
just to finish on this, because it does sound like you've delivered guidance without really properly consulting people who are at the show.
I was actually asked to be on the panel, but I was told I mustn't do media for a whole year or talk about my what I thought of cannabis. Yet, I said I hope that you make sure that everyone on the panel doesn't do that. Yet we see Finbar O'Callaghan, who sat on that panel, coming out and saying about his concerns about cannabis. So why are the same not being afforded to him? So I was told I could have a place on that panel if I was quiet. And I was not going to be quiet.
The way we organise our committees is we always, until our guidance is out, we always ask for that confidentiality, and we do have the consultation period, which we're in now, which is where we will listen. People can consult, can give us their comments. So we have until the end of August to do that. So just going back to the point about what we can do as a system, I think that's a fair point. It is complex and it involves many players across the system. Nicest part was to look at the clinical and cost effectiveness of these products in a range of conditions, which we've done and gone out with recommendations which we're consulting on at the moment. There are other players in the system. There's the regulator for medicines. There's NHS England.
Is there a real prospect though at the end of this 4-week consultation that suddenly people might be able to get cannabis on the NHS?
I can't say that because I don't know what consultation comments we're going to get.
But I mean, it's a possibility, is it? Things could turn around that much, could they?
I don't want to be drawn on that because we don't know what comments we're going to get back. But we've looked at the evidence.
Well, I mean, you know how people like Hannah feels.
We've looked at the evidence, and in epilepsy, I'll come back to it, we were unable to find the quality of evidence that allowed NICE to say, do you know what, we're going to make a practice recommendation.
I don't understand why the Chief Medical Officer did, though. Why did the Chief Medical Officer say, last July, there is conclusive evidence? Why? Because her background is in research. It doesn't make sense, and it is not fair to, as we said, the government said we didn't manage expectations
before when you were thinking about it.
We need to help people.
Okay, that's a strong voice, isn't it?
Indeed. So when we looked at the evidence base, we go out with a scope. What should the guideline cover? And again, we consult on the scope, and then we look at the evidence base, and we found about close to 19,000 studies, which we then limited back down. In epilepsy, we found 4 that were of sufficient quality because there's not enough information on
we just need to bring in Clark French because he's been waiting really patiently.
Yes,
and Clark, we've not come to you yet, but you buy cannabis yourself, you get hold of it, you freely admit illegally because you say that you need it and you can't get it on the NHS. Why are you prepared to break the law to get it?
I think this is a problem that many patients face. It's not just me, there's actually millions of people in this position where we face the choice. What do? Do we break the law to access this medicine that improves our quality of life, or do we follow the law and not get the quality of life that everybody deserves, right? We're not talking about rocket science, we're talking about a plant. This is a plant that has been used for thousands and thousands of years. It's got, yes, the reason why it doesn't have the clinical evidence that NICE needs is because it's been in Schedule 1. It has not been able to be researched because of that, right? So NICE need to take that into account with what they're doing, and the government really need to make sure that they're not failing patients, because currently a handful of people are able to get it, and everyone else still faces prosecution from the law. Everybody else still worries about having their door kicked in, having their children taken away from them. This is war on people, the war against drugs. This is what is happening. People are having their houses raided. People are having their medicine taken from them, and or they're not having it and they're deteriorating and they're getting ill. Like, that's the choice that currently everybody is in, and it's not right. Unless you've got £800 a month to spend on a private prescription, which, you know, currently we don't, but, you know, maybe the people in government and their friends all do. You know, it's not fair. It's not for the people. It's not for everybody. And there's a two-tier system right now where people who have the money to pay for a private prescription can go get that prescription and can fulfil that and can not be a criminal anymore, and the rest of us, no, you can just be a criminal, you can just face prosecution, you can just have all your life you know, destroyed by this stupid law. It's not right. It's not fair. And as Hannah rightly said, we need this to change urgently.
Clark, thank you. We've got a statement actually from the Department of Health and Social Care saying we sympathise with those dealing so courageously with challenging conditions, and the government has changed the law so that specialist doctors can prescribe cannabis-based medicinal products where there is a clinical evidence of benefit. To support doctors prescribing these products, we've asked the National Institute of Health and Care Excellence to develop additional clinical guidelines, and we're working with the Health Education England to provide additional training. The decision to prescribe unlicensed cannabis-based products for medicinal use is a clinical decision for specialist hospital doctors made with patients and their families, taking into account clinical guidance. So we've got, what, 4 weeks more for you to come up with the finalised report, is that right? And the ball is in your court.
Well, it's partly, and with other. Just one last point about, even if we had found good evidence, in epilepsy, we just talk about that for a moment. These are unlicensed medicines, so doctors would still have to step through licensed medicines first and then work through and only reach unlicensed medicines only as a last resort. So it's a very important point to make. And that's the General Medical Council's prescribing.
And as parents, we're not saying that we want it on tap. We're saying we want a sensible conclusion. Lastly, I'd just like to say, the UK is the biggest exporter of medical cannabis to the world. Why is our government not allowing its people to have access to a product that it's making a lot of money out of? There's a question for you.
People getting in touch while
really
you're talking.
Makes me very angry.
Claire on Twitter says, I was on 448 tablets, 14 years of chronic pain, failing classes, locked in my house and bedbound with pain. This year I started using marijuana. I got straight A's in uni. I've started cycling, going out, down to 30 pills a month now. Paloma on Twitter, I've severe chronic pain that isn't responsive to conventional meds that are addictive. I fit criteria to be prescribed, but as I'm disabled and unable to work, there's no way I can afford it. It's unfair that I lived elsewhere. This wouldn't be an issue. It's cruel. An anonymous texter, medical marijuana has been legal in Canada for more than 20 years. Why doesn't NICE look there for proof? Leafy on Twitter, it's crazy. There's overwhelming evidence that medical cannabis is extremely effective for several severe afflictions, and the only reason cannabis is illegal is money. We've evolved with this plant and yet it's banned. It's one of nature's wonder plants. Thank you very much for your time. Thank you, and we'll catch up as well when the next period is done.
Very nice to meet you. Thank you.
Thank you.
Thank you.
Now, still to come, should sunbeds be banned? Doctors and leading health groups say they increase your risk of skin cancer, but the group that represents